All right, everyone. Welcome. Welcome back to all my listeners. This is episode 16 in season 12. Today is Wednesday, August 14th, 2024. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, let's go ahead and start today's episode. You know, it's the second Wednesday of the month, and that means it's going to feature my OIG Work Plan updates for the month of July 2024. And in my trusty tip, I'm going to go ahead and clarify places of service that continue to cause confusion for our providers offering up telehealth services in their practices. And of course, I'm going to go ahead and close out and round out today's episode with another remarkable quote on collaboration by Andrew Carnegie. Now, today's episode is sponsored by Advanced Coding Services. Whether you're just starting out or a seasoned professional, their training equips you with tools and support you need to advance your career. Their medical billing and coding school meets your needs worldwide, online or in person, with one-on-one support throughout your training. Now, Advanced Coding Services is committed to helping their alumni and credentialed medical community in keeping up with their certifications by offering various avenues for acquiring your continuing education units. In addition to their Mastering the Business of Medicine retreats, and I've been there, mind you, in San Diego and in Hudson Valley, and they are absolutely fantastic. They are also offered several times throughout the year in different parts of the country. They also offer memberships, which are fabulous. Now, you can conveniently earn your CEUs by attending our exclusive members-only webinars. I've provided those for them as well. I love Advanced Coding Services. Now, since their aim is to nurture and grow their member area, it's called the Apple Orchard. Advanced Coding Services. Educate, nurture, inspire, reaching back with a hand up. Let's get into it, you guys. All right, so in today's Newsworthy, the month of July's OIG Work Plan updates. They're going to be featuring 4 updates to the OIG Work Plan for the month of July 2024. Now, the first is titled Follow-Up Review of Durable Medical Equipment, Prosthetics, Orthotics, and Supplies Provided by Suppliers During Inpatient Stays. Now, this report is expected from the Office of Audit Services. Overlapping claims can happen when an enrollee receives a durable medical equipment, prosthetics, orthotics, and supplies, also called DME POS. Those items provided during their inpatient stays at an acute care hospital. In general, certain items, supplies, and services furnished to inpatients are covered under Medicare Part A and should not be billed separately to Medicare Part B. Again, this is pursuant to 42 CFR sections 409.10, as well as the Medicare Claims Processing Manual, Chapter 3, Section 10.4. Therefore, DME POS claims for enrollees who received DME POS items during an inpatient stay, which are going to exclude admission and discharge dates in a hospital, should not be billed once again to Medicare Part B, and any Medicare payments made on those claims would be considered overpayments. Prior OIG reviews and investigations have identified this area as a risk for non-compliance with Medicare billing requirements. For this follow-up audit, OIG will review Medicare payments to certain types of inpatient hospitals to determine whether claims billed to Part B for certain DME POS items provided during inpatient stays were made in accordance with federal requirements. Additionally, the OIG will review the CMS Common Working File System edits that should deny claims for DME POS items furnished during an inpatient stay. Now, this final report is expected in fiscal year 2025. Now, the second OIG work plan for the month of July 2024 is titled Medicaid Managed Care Capitation Payments on Behalf of Incarcerated Enrollees. Now, this report is expected to come from the Office of Audit Services. States contract with Medicaid Managed Care Organizations, or MCOs, to provide specific services to Medicaid enrollees, usually in return for a predetermined periodic payment known as a capitation payment. Section 1905 of Title 19 of the Social Security Act under 42 CFR Section 435.1009 and guidance from CMS state that federal financial participation is generally not available for services provided to adult inmates of public institutions, except when the individual is not in a prison setting and becomes an inpatient in a medical institution. OIG will then determine whether select states made unallowable capitation payments to Medicaid managed care organizations on behalf of individuals incarcerated in state prisons. This final report is expected in fiscal year 2026. Now, the third OIG Work Plan update for the month of July 2024 is titled State-Directed Payments in Medicaid Managed Care. Now, this report is expected from the Office of Audit Services. As the HHS agency overseeing Medicaid, CMS issued regulations establishing certain circumstances under which states may direct managed care payments to providers. These payments are referred to as state-directed payments. While working within federal parameters, states determine criteria for providers to receive these directed payments. For selected state-directed payments in Medicaid managed care, the OIG's objective is to determine whether, number one, the state obtained CMS approval for the directed payment proposal. Number two, if the state complied with CMS-approved requirements and outcomes in the approved proposal. And finally, third, if the state ensured that directed payments were made according to the approved proposal. Now, this final report is expected in fiscal year 2025. And the fourth and final OIG Work Plan update made to July 2024 is titled Medicare Payments for Clinical Diagnostic Laboratory Tests in 2023. Now, this report is coming from the Office of Evaluation and Inspections. Medicare is the largest payer of clinical diagnostic laboratory services in the United States. Medicare Part B covers most lab tests and pays 100% of allowable charges without patient cost sharing obligation. The Protecting Access to Medicare Act of 2014, also called PAMA, in publication L number 113-93, requires CMS to state payment rates for lab tests using current charges in the private health care market under Title 18 of the Social Security Act, again, under PAMA Section 216A. Now, on January 1st of 2018, CMS began paying for lab tests under a new system mandated by PAMA. PAMA also requires the OIG to publicly release an annual analysis of the top 25 laboratory tests by expenditure. In accordance with PAMA, the OIG will publicly release an analysis of the top 25 laboratory tests by expenditure for 2023. Now, this final report is expected in fiscal year 2025. And now it's time for my best practice tips in Trusty Tip. Now, I know it's been a minute since I've discussed telehealth on the podcast, right? Now, although there's nothing new here, there have been lots of questions around the country regarding telehealth places of service. I know so many providers have reached out to me directly regarding their confusion on these places of service. So I thought, why not put this into today's Trusty Tip? And it's going to focus on what's going on in the National Government Services region, the NGS region, that particular MAC for providers in states like Illinois. Now, there are two places of service for telehealth that require clarification. Telehealth places of service are 02 and also 10. Now, National Government Services has been receiving inquiries from providers in regards to place of service, or POS 02 and POS 10 or 10 for telehealth service reporting. Now, CMS issued a change request number 13582, specifically transmittal number 12671, which became effective on January 1st of 2024. So just 7 months ago, right? Now, although this transmittal didn't provide new information, it manualized past instructions and clarified that place of service 02 is paid as a facility service versus place of service, or POS 10, which is paid at the non-facility rate. Now, this is identified in CMS Internet Only Manual, that IOM publication 100-04, as well as in the Medicare Claims Processing Manual in Chapter 26, Section 10.5, in the place of service listing. Now, included in this change request and update to the IOM, CMS indicated in, quote, special considerations for telehealth claims, Code 02 and Code 10, end quote, that the place of service may be used and must be paired with the appropriate telehealth modifier of 93 for audio only, as well as modifier 95 for audio and video. Now, this is new information as the 2024 CMS Physician Fee Schedule final rule indicates there are only specific instances for the use of modifier 95. Modifier 93 has not been indicated as necessary for any audio-only services by the CMS. But make sure you're also looking at your commercial payers as well and see what modifiers they require for audio-only services. Now, if you choose to use the modifier 93 or 95, keep in mind that these are informational modifiers only, and they will not impact your payment or the allowance of the service provided, and as such should be listed after any payment modifiers. So remember those modifier placement rules as well. And be mindful that modifier 93 here in the NGS region would not apply to audio-only mental health services, as CMS has issued specific policy for those services to be billed with the modifier FQ, or F as in Frank, Q as in Queen. It would not be appropriate to bill the modifier FQ in conjunction with the modifier 93. Finally, in my Spark, and the 12th season Spark on collaboration, I want this 12th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for collaboration. So, in this week's inspiring quote in Spark is from Andrew Carnegie. Teamwork is the ability to work together towards a common vision, the ability to direct individual accomplishments toward organizational objectives. It is the fuel that allows common people to attain uncommon results. Absolutely true, right? This quote is huge. This quote reminds us that working together makes a difference. This quote encourages us that our collaborations fuel not only organizations to new heights, but they create some of our most inspirational leaders. I'm happy Andrew Carnegie's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. All right, you guys, I'm going to wish you all a very, very happy week ahead. I hope you guys got your fill of the Olympics in Paris. The Paralympics are still going to be going on for the next couple of weeks as well. So make sure you tune in and enjoy. All right, you guys, thanks so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.